the patient. Adar Abhinandan Abhar. Namaskar, Adab, Sashyakal, hello, and a very good morning, ladies and gentlemen. A very, very warm welcome to absolutely wonderful, beautiful, and auspicious day that brings together so many special people to impart knowledge with their expertise and experience skills. Synapse 2022. I am Ashu, and today I have been given privilege to be your host for the day. Today we are here at Synapse 2022 by CIOS with an aim to enhance clinical skills key to success in physiotherapy. Inauguration of Advanced Physiotherapy and Clinical Competency course. Synapse is a team of physiotherapists working for unique goals to meet up physiotherapy and rehabilitation demand at various special medical and non-medical areas. Moving forward, physiotherapy. So we all are familiar with the term physiotherapy. Physiotherapy or physical therapy is recognized as autonomous healthcare profession concerned with movement science and aims at maximizing quality of life by optimizing the movement potential. We all know that COVID-19 has challenged all the healthcare professions, including physiotherapy. Increased mobility and mobility was seen in patients. But challenge has been taken by physiotherapy so well that it has fulfilled the aim of reducing associate mobility by gaining function and improving the survival. So here, today Synapse stick to an effort to organize a knowledge imparting academic event in order to enhance clinical skills by the success of physiotherapy. So, a physiotherapist is a brain of scientist, the heart of humanist, and the hand of artist. So, I welcome you all the artists. Can we have a round of applause to all of you present in the hall? Moving forward, we are being given so much privilege to have special guests for this event to make it a grand success with their valuable efforts in the field of physiotherapy. Dr. Karthik, Assistant Professor, Department of Orthopedic, PJMIR, Chandigarh. Can we have a round of applause for him? Dr. Sandhil, Professor, Department of Dermatology, PGIMR, Chandigarh. Can we have a round of applause? Shri Rajashekhar, Journal Secretary, Chandigarh Tamil Sangam. We welcome you, all of you, sir. With all due respect, I would like to call all the guests and all the members of CIOS to enlighten the function by lighting up the lamp of bright. We welcome you, sir. Synapse 2022. May God bless us with lots of happiness and greetings. To seek the blessings from God, let us join our hands toward the god Shiva. Here's the Shiva Tandam Stotra.
जटाटवीगलज्जलप्रवाहपावितस्थले गलेवलम्ब्यलम्बिताम्बुजङ्गतुङ्गमालिकां ढमड्ढमड्ढमड्ढमन्निनादवड्ढमर्वयं चकारचण्डताण्डवं तनोतु नः शिवं शिवम् जटाकटाः सम्भ्रमभ्रमन्निलिम्पनिर्झरी विलोलवीचिवल्लरी विराजमानमूर्धनि धगद्धगद्धगज्ज्वलल्ललाटपट्टपावके किशोरचन्द्रशेखरे रतिः प्रतिक्षणं मम धरेन्द्रनन्दिनी विलासबन्धुबन्धुर स्फुरादिगन्तसन्तति प्रमोदमानमानसे कृपाकटाक्षधोरणी निरुद्धरुद्धरापति क्वचिद्दिगम्बरे मनो विनोदमेतु वस्तुनि जटाभुजङ्गपिङ्गलस्फुरत्फरामणिप्रभ कडम्बकुङ्कुमद्रव प्रलिप्तदिग्वधूमुखे मदान्धसिन्धुरस्फुरत्वगुत्तरीयमेदुरे मनो विनोदमद्भुतं बिभर्तु भूतभर्तरी
What a musical start. I hope you guys will have a great time. So moving forward, we have our special guest, Dr. Sandhil. Good morning, sir. We welcome you. So there's a lot about Dr. Sandhil. It may take a long day. Many awards received, latest being the L.N. Sinha Award in 2020 for the Best Young Dermatologist in India, Best Research Paper Award for the Best Research Paper published in Indian Journal of Dermatology, at present Editor-in-Chief Pigment International Journal and Selection Editor of Frontier Journal of Allergy. Has given many presentations in national and international conferences, is a reviewer of many national and international journals. We welcome you, sir, to come on stage and enlighten the young mind and fill their mind with beautiful thoughts and your experience. A great applause.
Good morning, everybody. It gives me immense pleasure and honor to address this august audience. Thanks to Dr. Balaji for inviting me here. Physiotherapy, we all know, is an integrated part of our medicine. And being a dermatologist, it is important to me where it becomes helpful in treatment of my leprosy patients. How to treat the claw hand, whether it is a partial claw hand or a total claw hand, presence, and then the treatment of wrist drop and foot drop, as well as management of trophic ulcers. So that's where the physiotherapy becomes very important to me. And in fact, we do take classes for the physiotherapists in PGI, and of course take their exams also. And it is more dear to the orthopedician, my junior colleague who is sitting here, Dr. Karthik, so that's the thing. And little bit about this one. Dr. Balaji has been doing a lot of work, recently conducted many conferences around India. I think so the latest one was in Bombay or something like that. And congratulations to him, recently had got a degree also. And not only as a part of this Synapse, the Synapse is also working about helping the poor people also. Apart from the regular physiotherapy program which is running in the colleges and in universities, he is also doing a lot of help to the poor patients who are there in the periphery of Chandigarh itself, going to their home visits, helping out regular, getting in touch with them, looking into their well-being. And also he takes a lot of other cultural activities also. And tell you the truth, if whether you know or not, Dr. Balaji is a multi-talented person, and he is well-versed musician, and we have to learn a lot of music from him. And so today's theme is enhancing clinical skills, key to success in physiotherapy. Enhancing clinical skills is a must, because more better in your clinical skills, more better is the wholesome management of the patient, and wholesome management is better, the patient outcome and the quality of the life also improves. So hope this academic extravaganza which is given for you will be of a great success, as well as enjoy the musical one also which is there in the evening. Thank you very much.
Thank you so much, sir, for your valuable words. I would like to call Dr. Balaji to honor the sir with memento. Thank you so much, sir, once again. So our next chief guest is Dr. Karthik, Assistant Professor, Department of Orthopedic, PGI, Chandigarh. He has gained a lot of awards. List may go on, but few are. Second Best Oral Presentation in 2016, Harry Benz Award, AADO Fellowship in Trauma, Hong Kong, National Fellowship in Orthoplasty, IAA, India. I welcome you, sir, on stage to share your valuable thoughts with people.
Good morning, everyone. First of all, I am humbled and privileged to be a part of this wonderful CME on the topic Enhancing the Clinical Skills, a keys to the success in physiotherapy. The physiotherapist is an integral part for treating the musculoskeletal pains and all the orthopedic problems. I always tell, when the most common problems coming to the orthopedic OPDs are cervical pain, low back pain, and knee pains like that. So we will give treatment like to start with physiotherapy and to add on some analgesics. I always tell my patients, in physiotherapy is the main treatment, the analgesics are simple supplements. So the physiotherapist is somewhat like a right hand to me. So without you guys, I am not able to give good functional outcome to the patients. And today also I like this theme topic, enhancing the clinical skills. This is very important because most of the times we will diagnose, I will write it is an acute lumbar strain. I will refer the patient to the physiotherapist. So if the patient, sometimes being a physiotherapist, you should also do some clinical examinations and you have to diagnose the patient. Sometimes my diagnosis may be wrong also. So sometimes you can refer the patients back to me, sir, I am doubting the diagnosis. Please, you can reconfirm the diagnosis with your clinical skills or by taking an additional imaging like MRI. So that we are both walking hand in hand so that the patients will get a good functional outcomes. Okay? So Dr. Balaji, being a physiotherapist, he is doing a wonderful charitable works. And today Dr. Sendil also told he is a good musician. I didn't witness that, but I will get an opportunity to see that too. So I wish you all the guys a very wonderful CME today to enhance your clinical skills along with some extracurricular activities like dance programs in the afternoon sessions. Thank you once again for inviting me to this wonderful CME session. Thank you.
Thank you so much, sir. I would like to call Dr. Balaji. Thank you so much, sir, for sharing your knowledge. Our third chief guest is Sri Rajashekhar, Journal Secretary, Chandigarh Tamil Sangam. I request you, sir, on stage and share your beautiful thoughts with young people.
Namaskaram, Sastriyakal, Vanakkam, and good morning. And it is a strange for me why Dr. Balaji invited me for Synapse 2022. मेरे को कुछ पता ही नहीं. Doctors are there, professors are there, so much of eminent faculties are there. I don't know what I have to speak. I asked Dr. Balaji just 10 minutes back, sir, why did you call me? मेरे को किस लिए बुलाया आप? He said me, sir, so many young people are there. Whatever you are enjoying in Tamil Association, just enjoy. Just 10 minutes back he said. Then I asked Professor Senthil, Dr. Senthil, sir, you all are talking about some medicine, physiotherapy. What should I talk? कुछ नहीं सर, आप कुछ नहीं, ऐसे बात करके आओ. First of all, I am very happy. There are so many female candidates are sitting over here. Please put a round of applause for you all people. Because I personally believe every therapist is a mother. सर आप तो पता है, आप फिजियोथेरेपी के बारे में क्या पता है? I know. A couple of months back, I had a frozen shoulder. Generally, I don't tell about my problems to others. But Dr. Balaji is almost like my son. He came to know, he kidnapped me. No, kidnapped. He has sent his driver, lifted me, taken to his hospital, and he solved the problem within 5 minutes. I am really amazed. I don't know what technique, and he was, during the treatment, he was consoling me. Okay, sir, everything has become all right. Everything has become, I really felt a motherly touch with Dr. Balaji. So I expect each and every one of you, those who are sitting here, since you have come to Dr. Balaji, each one of you should be like individual Balajis rather more than a Balaji. Because why I said this much Balaji? Because there is a Balaji temple in south, you are aware? So he is not less than that. So I will take a couple of minutes to talk about that gentleman. उसके बारे में ज़्यादा गुनगुना नहीं कर रहा हूँ, because I am a general secretary of a socio-cultural organization where we do a lot of social services to all the needy people, and I have been doing these services almost for 30 years. So I used to think that I am the one of the next Mother Teresa of India. इतना घमंड था हमारा, अरे क्या काम कर रहे हैं यार हम, गली गली में जाके लोगों को मैं मदद कर रहा हूँ, इतना बड़ा आदमी हूँ मैं. I was thinking that way. But again, a few months back, I went to a Punjab village with Dr. Balaji. He took me there. I saw those people. There are 20-25 bedridden people, those who got a spinal injury. Literally, I cried. I went outside and I started crying. Then he dragged me inside. What are you doing, sir? No. Very silently, I am very close associate for Dr. Balaji. Without even telling me, he is doing the service in that village without expecting even a single penny, spending a lot of his resources, money. So that is the reason I said, only a person who is having the motherly thought can only do this. And I am very proud to be associated with Dr. Balaji. That nurtured me, that has given me, that has enlightened me. Then immediately what has happened, we have conducted, generally we conduct a Pongal festival, Sangrant, January 26. So I have invited Honorable Governor of Punjab, the Mayor of Chandigarh, and so many people. Immediately I thought, why we should cook the Pongal and we should eat ourselves. And with the help of Dr. Balaji, almost for 4 lakhs rupees, we have purchased all the implements for the spinal injured people. In that one, almost 2.5 lakhs rupees, the worth of material Dr. Balaji has contributed for the social cause. And we are really thankful to him. And I am having a wonderful doctors associates, our Perumal, Dr. Sendil sir and Dr. Karthik sir. I am very proud to be associated with these people. They have given me almost 2 lakhs worth of water bed, air bed, so many implements to me. Because with the name only I am getting, everything, this wonderful team we are getting. So you are having this enhancing clinical skills and a part of your curriculum, maybe there in the physiotherapy, not only for earning money. If you are just mixing your profession with your social thought, wonderfully you will become another Balaji, even more than that. I take this opportunity to request you, because you are the only one profession. You need lot of patience. Because again, I'll take 1 more minute, because again, I remember a year back, we went to a unit where you treated the children with autism. I took him, I got a special permission from Air Force Station 12 Wing Chandigarh. I went to the station commander, I spoke to him. Then he asked, what is the specialty of this physiotherapy? Already in the Air Force we are having a physiotherapy. Then I asked, no sir, he is internationally a certified person. He is pursuing the PhD and now he got his PhD also. He got so much of certification and he has given a paper, the physiotherapy on music. Am I right? I think technically I may not be right. 1 year back, I'm an old man. You should correct me if I'm wrong. Then immediately station commander has given a permission. I took sir and the entire beautiful team of PHYSIO Synapse and the students. There were so many children, they never responded, sir. They never responded. But sir has sent one guitarist, one singer, some 2-3 people. मैंने डोसा इडली वगैरह अरेंज किया, वो कोई नहीं खाया. But he started singing. Dr. Balaji along with his team started singing. The child who was not responded almost for 6 years in that institute, the child started clapping, sir. जो बच्चे 6 साल से कुछ नहीं किए वो ताली बजाना शुरू कर दिया. And really it is amazing. It's really amazing. And everybody now recently in the Central Command of Air Force Station, I forgot to tell to Dr. Balaji, the Central Air Command, CAS, Central Air Command, CAC, the headquarters is there in the Delhi. They asked me a briefing about Dr. Balaji. I forgot to tell you. So because the 1 year back program, they made a list and they sent this thing to Air Force. Suddenly they were making a presentation about you. And so that means it is reaching, your profession is reaching to those people, even those who are mentally ill. So the physiotherapy